keep going, yeah.
First, decide on the most appropriate size of Igel O2 to use. Correct size is normally determined by weight. Open the Igel O2 rhesus pack. Remove the inner tray containing the lubricant, airway support strap, and suction tube, and place the contents to one side within easy reach. Place a small bolus of lubricant on the base of the inner side of the main shell of the packaging. Touching no lower than the bite block of the Igel O2, lubricate the back, sides, and front of the cuff with a thin layer of lubricant. Ensure any excess is removed. Grasp the lubricated Igel O2 firmly along the integral bite block. The ideal patient position for insertion is with the head extended and the neck flexed. But if this is not possible or is inappropriate for the patient, then Igel O2 can be inserted with the head in a neutral orientation. A proficient user can achieve insertion of Igel O2 in less than 5 seconds. Introduce the leading soft tip into the mouth of the patient in a direction towards the hard palate. It is not necessary to insert fingers into the patient's mouth. Glide the device downwards and backwards along the hard palate with a continuous but gentle push until a definitive resistance is felt. Do not apply excessive force. The tip of the airway should be located into the upper esophageal opening. The cuff should be located against the laryngeal framework. The epiglottis should be held in place by the epiglottic rest. The gastric channel should open into the esophagus, and the incisors should be resting on the integral bite block. The Igel O2 should now be secured in place with the airway support strap, or taped down from maxilla to maxilla. To use the airway support strap, slide it under the patient's neck and secure it to the Igel O2 hook ring, using the appropriate holes on the strap. Ensure there is sufficient tension to hold the Igel O2 securely in place, but not excessive tension that may cause trauma to the patient. Some adjustment of the strap may be needed. A resuscitation bag can then be connected to the Igel O2 and ventilation can begin. If your